episode of Physio Ask Physio Life. It'd be helpful if I can get the name right. It'd be a good start.
Episode 15.
Episode 15 and counting. You'll get bored of us soon. Once we get up to 100, that's the goal. Well, what celebration are you going to do for the 100th episode?
Maybe we'll do a giveaway or something for the 100th episode.
Feeling generous.
Wow.
So, any news this week before we get started on the questions?
Yeah, big news today, Physio.
It is, yeah. Kat's birthday today. I was going to actually reveal what age she was there.
What is she?
I can't reveal.
Good on him.
Confidentiality. She
It
swore me
is
to
Kat's
secrecy.
birthday
She
today.
always gave me 20 quid to tell me not. Tell me not. She's under 30, would you believe? So happy
Sure, we
birthday,
all
Kat.
are, all there, aren't we?
Yeah.
Happy birthday, Kat. Big shout out to the Pilates crew this morning who did actually both classes did a very nice rendition of Happy Birthday for her, so thanks for joining in that, and the cake was tasty. Any other news?
No, we've a new girl starting with us next week.
Girl.
New Katie,
New physiotherapist.
new
maybe?
physiotherapist.
Okay.
Another female,
Yeah, so this
another
is
addition.
Hot off
definitely.
the press news.
Definitely getting outnumbered in terms of
So
ratio of male to female.
Catherine Merrick is her name, and we are really excited. So stay tuned on Monday. We'll have loads of information about Catherine and where she's from and her background in physio, and hopefully she'll be with us on Monday morning in Barna.
Yeah, all going well.
Yeah.
Fingers crossed. And it's the storm.
Storm.
Storm of feeling. Yeah, good.
In terms then of Kelly Beggs, just a big shout out to everyone who's come to see us in Kelly Beggs in the last week. We've just been blown away by the fact that the clinic was full, first of all.
Couldn't believe it, yeah. First
And
full day it was full.
so we've extended the opening hours now for demand. So if you know anybody in Kelly Beggs that needs any help or is struggling with pain, just let them know that we're in Kelly Beggs now, because the biggest reason that we did our Kelly Beggs clinic was simply access for people within the community, within the west of the county. So we were finding if people didn't have their own means of transport, it's really tricky. The public transport is so poor here. They're really relying on family members to drop them to either Ardara or Donegal town, and they were struggling to even get down to us. So the Kelly Beggs clinic really does help if people don't have that transport. And even for the people, there's that bus that does the route through Glen, and it's great because it picks patients up and drops them off at their door, and it means that they can come to the clinic and they're not under pressure to have someone pick them up and drop them down. So far we think it's been working well, and we are very excited to be up there.
Yep.
I think we obviously told you last week about our home visit service, which is now up and running, and I actually did some home visits this week, which was fun.
It's always different
Yeah, it's
environment.
nice to get out of the clinic for a while.
In their own
Yeah.
environment.
Yeah, so just to kind of let people know again, so our home visits are really there for people who can't get into the clinic usually because physically they're limited at that time. So if it's the early days post-op, or it's somebody who has got reduced mobility and you're just trying to improve it at home, then give us a shout because we can come and see you. And actually this week's visit was really interesting because my job on the first session was really to have a look at the house and look at what I could do to try and make things easier for that person at home. And I actually linked in with the district nurse and with occupational health to try and put a few things in place to help that person get around their home a bit easier. So that can be massive in someone's life if they can make it easier to get on and off the toilet or to get in and out of their bed. So just by being in the house, I pick those things up, which sometimes you won't do in clinic when they're coming in and out.
It's hard to get a figure for it.
So our home visit service is up and running, so if anybody needs us, you just give us a shout. Alright. So let's do what we're supposed to do here.
Just crack on. Yeah, it's good. 5 minutes waffle there. Sorry.
But we like our news update. Don't know.
Do we?
So hi to everyone that's watching. Thanks for tuning in. Let me bring this up now so I make sure that I cover any of those comments. Let's mute that. Okay, so for everyone that's watching, thanks all for tuning in. And if you have any questions, can you please just let us know? We're going to address one of the questions that came in last week, first of all, that we didn't get to. But anything burning on your mind from a physio viewpoint that we can help with, either comment below or send us a private message. So just to go back to the question from last week. Keep talking, Emily.
The question was related to back pain.
It was.
So you're going to pull it up. What we'll do is we'll discuss the issue around back pain and discuss general management of it, and then what we'll do is we'll go through one or two simple exercises that you can start with. Obviously, this isn't you can't just generalize these exercises to everyone. You have to be a little bit more specific. So it is hard to give specific exercises for your type of back pain. But we'll give you an idea of some of the exercises that we might prescribe to some of our patients in clinic with back pain.
Sorry, I'm being really blind.
Good. And if anyone wants me tomorrow, I'll be non-contactable.
Why?
Kira's going to do all the work tomorrow on the phone, on email and stuff. I'm going to be sitting down in front of the TV, watching the sport all day.
Oh.
2 Ireland games, and Kilcar are out against
Well, I will do that for you.
So,
you can enjoy your Saturday.
Yeah, absolutely.
I'll make you dinner. You don't have to get up off the couch. See, it's official now after this. Alright, I got the question. Let's focus here. Okay, so I had an operation on my back a few weeks ago. I'm just wondering, can you do the exercises to get my back in good shape again? So, yeah, first and foremost, we don't know what type of surgery this patient had. There's 2 common types of back surgery. One is a discectomy. So that's for patients who have a confirmed disc bulge significantly affecting a nerve. So usually these patients will have their symptoms mainly in their leg. They might have pins and needles, they might have numbness, they might have weakness. It's not settling and they've decided to go down the surgical route. So that's the most common surgery that we see. The second one is if the patient is a little bit older, we would see that they then do sort of a discectomy with a fusion. And that's where they put in a little bit of mechano to hold the pieces of vertebrae together. So the difference is just that the second group of people will tend to be a lot stiffer because naturally that's what they've done. They've stiffened up the spine. It's very hard to generalize here because it's a few weeks down the line. It's going to totally depend on your pain levels and how you're feeling. Will depend on what exercises we do with you. So we will assess these patients when they come into us. We'll look at exactly how they're doing, exactly what surgery they had, and that will impact what we do in terms of post-op intervention. So if this person is watching, if you could just maybe let us know what surgery you had, and then we can be a bit more specific with the exercises. If not, we'll make maybe an assumption that was a decompression. So just to be clear that if you're in any doubt about anything that we say, you must get it checked out, particularly post-op surgical wise. But I think it might be a good idea to go through some of the basic things that we would do with these guys post-op, just to give you a little bit of an idea. Will we do it in the gym?
Yeah.
The first thing we'll do is do a check and make sure that they've got their sensation, that their legs are working normally. And so we've done our assessment and we assume everything's going well, everything is standard protocol. So first thing I will generally do, and Ollie, you butt in here if you were doing anything differently, I would start looking at them on the bed in supine to see what kind of control they've got. And I would start my exercises with some trans-ab activation and maybe even some pelvic floor. And I would work from there to see how I could challenge that. So normally I would start in line. I would normally do this on the bed with them. So they would be in line, and actually that's the first thing. We would log roll post-op. So when you're getting into sitting, you'll be sitting on the edge of the bed, and then you'll come down on your side, like so, and then turn onto your back, like so. So you would, when you're getting in and out of bed, log roll, come into the side line first, and then up. So in terms of those initial exercises, I would look at first of all trying to get the bottom of that back moving with what we call pelvic tilting. So anyone that does Pilates with us that's watching will know this, so give us a thumbs up if you know what your pelvic tilting is about. And that's where I would just get you to start rocking that pelvis into the bed. So you're rocking the hips back, flattening it right in, and then arching away. Any objections here, Ollie?
No, maybe just stick your hand in underneath your lower back to give an idea.
Okay, so if you arch away, your whole hand will fit underneath there. And then when you flatten in, you shouldn't be able to get your hand in at all. So that movement is happening by rocking the hips forward and back.
And your bum is staying where it is.
Absolutely stays on the floor. So some pelvic tilting might be where I'll start to get the bottom of that back moving gently. Then I'll concentrate on getting their tummy contraction. So I'll speak them through this transab contraction. So I'll get them to just think about gently pulling in that lower part of their tummy, very gently. It's not a full-on crunch of those big abdominal muscles, it's a lower down muscle. So I normally say to them, gently pull in that belly button towards the mat underneath you, and then the pelvic floor. Just imagine that you're stopping yourself going to the toilet, so you're pulling up from down below. And I would work on that for a little while, contracting and then relaxing, contracting and then relaxing. And then I would see, can we start to challenge it? So in the early days post-op, I'd get you to get your tummy contraction, and I would start with heel slides. Slide one leg down the bed, still holding on to that contraction, slide it back up again. And then repeat on the other side. Slide, holding on to that contraction if you can, bring the leg back up, and then relax off. Right, so heel slides is a good place to start. Then I would do knee rolls. So again, tummy tight. Normally start with one leg. Can you drop that leg out to the side? And then bring it back up. Repeat on the other side. Tummy's tight as the leg moves, and then relax it when it comes in. Once that's comfortable, I'll tend to combine them. Both legs over to the side, just trying to get more rotation. And at the start, you mightn't feel comfortable going that far. You'll go as far as you feel you can. If you feel it pulling, then you'll come back to the centre. You shouldn't feel any pins and needles, any tingling or any pain in the leg when you're doing them. If you do, you need to stop and check it out with your healthcare professional. Other side, back to the centre. So those are day one, early days, get that back moving. Then to progress it, I'm going to run through just a few samples. So bridging all it.
Yep.
Yep, so tummy tight, and you would lift the bum up and then back up as far as you comfortably can. And if you start to feel a little bit of ache across the back, then you stop, you roll it back down. And then over the days you progress that one where you lift the back up and you work until you're right into extension up here. And again, that will depend on how you feel, how high you'll come up, and roll it back down. So your bridging is a good one.
How many would you do?
Early doors, I might do 10 reps and then do that 3 times a day. As they get stronger, I would bring that much closer together and get them to do the 30 reps in one session, maybe taking a minute or two between the 10.
Mm-hmm.
And then as it gets easy, I would progress it in different ways depending on the patient.
Okay.
I like the roll-ups for my back patients as well. And this is where tummy's tight. You just gently roll the head up, shoulders up, focus on that tummy contraction, roll it back down, and then relax off. And then doing some work in those tabletop positions where you bring one leg into hip flexion, and you can progress these really easily. So you can start with one leg in that position and tummy tight, drop the leg straight, and then bring it back up to that tabletop position.
Just to interrupt you here, just to answer a question, Dan has just asked, what are we learning here? I missed the start.
Oh, good question, Dan. Dan, what we're doing here is going through post-op exercise for someone who's had surgery on their lower back for a discectomy. So these are, and actually, you know what, scrap that. These are exercises for back pain, recovery from back surgery. So they're the simpler ones we showed first, and now these are the progressions we go on to.
Perfect.
Yeah, so it's one leg up in tabletop, tummy tight, and you're thinking about that tummy contraction and pulling up that floor, pelvic floor, dropping the leg, and then back up to tabletop.
What's important here?
Important here is that this pressure is not coming through the back. You're working your core here so that you don't arch. So as that leg comes down, that you don't arch away from the mat. If we see our patients doing that, then this exercise is too much. We'll drop the leg down and we'll go back to heel slides. Now, if they're doing that and there's no bother whatsoever, there's no trouble, we might start to progress it to the next level. I'll put their hands down in the bed and I'll think about coming into double tabletop. And again, now this, you're talking, 6 weeks down the line, maybe post-op from your post-op surgeries, but just gives you an idea of the progression. So it's tummy tight, lifting one leg up to tabletop and then the second leg. Bring first leg down, second leg down, and then relax. And in this one, it's really important. If I do this with my patient, when they lift the second leg, they arch away, then straight away that leg's coming back down. They don't have the control to be in that position, and we step it back down. If they're doing well, I might start to get them to hold that position, and then pat the arms. Or then you could hold that position and do your leg drop. These are all progressions. Hold the position, add your roll up.
Yeah, that's a serious progression. That's kind of 8, 10 weeks, 12 weeks down the line.
Even more. This is
Yeah.
all relative to how you feel and how your back pain is. The key is that you cannot start with this heavy loading until you can control and have pain-free back movement with the simpler exercises at the start. But it gives you an idea of where it goes to. This is the kind of exercise that I would discharge my back pain patients with to do long term to prevent flare-ups.
Mm-hmm.
So, and as Ollie said, that might be 3 months down the line surgically, but that's the kind of stuff that we build to make sure that this doesn't come back down the line and they don't get problems down the line. Any of my patients are out there that have seen me for back problems, they'll notice that progression. We'll start with the simple stuff, maybe straight leg raise, heel slides, we'll progress to bridges, then we'll start the tabletop work, then we'll try to load it up even more. And that comes week after week after week of work. So I guess and that's a snippet of stuff. You can do loads of stuff inside lying for it as well. You can do work on your tummy for it. There is loads of options out there. I think the key is to just link in with your healthcare professional so you can get a program developed for you to make sure that you're working at the right level.
It's important that you don't overextend yourself, particularly in the early stages. That you don't
have to let yourself recover.
You can make it worse. You can really irritate that back.
And really, when we choose to progress our patients, we're really watching what their control is like, what their spine is doing when they're moving. Like, I'll often do those little movements as tests, and when I see them arching, I say, right, scrap that, we're going to come back to that in a few weeks' time. So you build the progress as they feel able. Alright, but we do know that exercise is key. And the other thing too post-op is to get back to your walking or your cycling or your swimming. You know, doing your cardio exercise as well post-op is important. So hopefully that gives you a little bit of an idea.
Brilliant, good.
Yeah?
Yeah.
Go back in.
I'm going to say, do you want to end it there?